Hey there, sports psych enthusiasts. I'm Dr. Colin Fehr, and I want to share my passion with you. I love talking about ways to unleash the power of the mind. This recording is part of a larger lecture series I've created in an effort to make sports psychology concepts more accessible to a larger audience. The information contained in this series is especially well suited for students of sports psychology and is presented in a way that makes for easy listening for all. Welcome to Sports Psych Concepts.
Howdy everyone, thanks for tuning in to this Sport Psych Concepts lecture recording. Today I want to answer a really kind of a foundational question that's based on, an assumption that anyone in the mental performance space carries with them, and that's basically that the work that we do actually works, that there's efficacy for what it is that we do, and it's demonstratable. And this is something that is important to understand because, again, we all operate from different assumptions from whatever space we're coming from. And in the mental performance world, it's always, well, yeah, what we do that works, and obviously it does. If it didn't, then we wouldn't be doing it, and all of that. But how does that match up with what is in the literature, the evidence base that's there? And so that's what I want to explore a little bit today, and just show you some of the nuance that's involved with that, because it's maybe not the safest assumption. I mean, it is and it isn't is kind of how I'm going to present it to you. But this is what I want you to think about. I mean, does mental skills training actually work with what it is we're doing? And so just before we get started, to reiterate, to make sure we're on the same page, I say mental skills training. Well, I could use that interchangeably with psychological skills training. And just to recall, we use that in sports psychology or any sort of performance psychology situation. We're using that to enhance the athlete's performance. And so, what we do is we'll teach these athletes, we use different methods, right, or techniques to teach these athletes these skills, help them develop these skills that are going to enhance the quality and consistency of their performance. And it's a really popular technique that's out there, or approach that's out there, a systematic approach where we build programs where athletes are working on these things along with the other phases of their season. The off season, we may introduce some new things, introduce the program, they have the preseason, and then we shift maybe, and then competitive season, and then the postseason, and we can follow along all of those different things. Okay, so just making sure we're on the same page of what we're talking about. But as we move forward, I really want to help answer this question of whether all of that effort is worth it and whether it actually leads to the outcomes that we want. So to make sure that we have a common understanding of what I'm referring to here before we even get into looking at the efficacy, because ultimately this is what some of the conversation here depends on, is what is a psychological skill? How are we defining that? Is the definition consistent throughout the literature and how it's being assessed? Right? You can see how this ties into, well, yeah, they've got that skill. I can tell they have the skill. Well, how did you measure it? How did you define it? If you didn't define it, then you can't measure it. And so then you can't say that they improved it and that was tied to their performance, right? So hopefully you can see that link in the logic there of how we're determining whether this is our mental skills training is actually working. So practitioners, there is some debate on how we're defining psychological skill, or some of the different psychological skills that are out there. If you look in the literature, there's a significant heterogeneity, so that can make it confusing. If we're not defining them the same, then how can we take a comprehensive perspective or look at these skills that are defined? We can read different studies that say, oh yeah, it supports it. There's evidence right here in this study that this skill, if we develop that, then it led to an enhanced performance. And then this other study said it too, but it wasn't defined the same between those studies. So you can see how that can lead to some confusion. Okay, but one definition because we do want to try and categorize this somehow. but there isn't a universal definition yet. But one definition that we can use this as we move through this presentation, and we recognize that ambiguity with it, is that it's just the athlete's ability to learn techniques or methods, modalities to then regulate or enhance certain psychological characteristics. So again, those tools and techniques would be things like imagery and relaxation and self-talk, and then the skill might be confidence or different motivational things or self-awareness. Those, or it could be even sport-specific skills that we could tie in there. Okay, and so these psychological characteristics that I was mentioning, right? You can define those as well. So maybe we could loop this in and say this is um, this is not the same as a skill, but there's overlap, and so again, it just feeds into my main point here. So we could define it and say, well, it's some trait-like disposition that then the athlete can regulate that, or they can enhance that through some sort of systematic development despite relative stability on that. Okay, so again, it's just not I don't want to share those things to confuse you. It's because you don't need to memorize the definitions. It's just to show that, like, well, what are we talking about? If we say psychological skill or we say psychological characteristics, are we talking about the same thing? And then we could say psychological tools or techniques or methods, and then we say psychological strategies. And so all of those things, we have to make sure that we're differentiating them to some degree, and we're operating from a common perspective on those to ensure that when we're saying or we're making a determination on whether these programs and these things that we're doing, they're spending time to build the interventions, whether they actually work. Okay, it's how we're defining them, and that matters, and that's the starting assumption. So let's look at the question itself, and I'm not going to do a huge survey of the literature. I'm just going to kind of share the general perspective that's out there based on some reading that I've done and looked into. So just keep that in mind, right, as a little caveat, because you could go and you could read the literature and maybe you have a slightly different interpretation or conclusion drawn from that, and that really just kind of makes my point here with this, right, is that we all can go and read it and look at the limitations and interpret those things differently. But I'm going to give you my perspective and take on this, on how we might answer this question, or just acknowledge some of the limitations there, because as a starting point, we can say that more athletes are using systematic mental skills training programs. That's increased because there's more of a recognition for it and how it can provide value, and if we can get any extra edge, and we're looking for that, because performance density is a real thing where athletes are just getting clumped together, and how do you distinguish yourself from the others? Okay, and so there's been some expansion on research in this because there's more use to examine its efficacy. But when confronted with a larger volume of research, then what we have to do is try and consolidate, or do a comprehensive analysis on this. And so you can go and you can look at some of the reviews that have been conducted in an attempt to summarize and then synthesize and simplify the evidence. Okay, and so some of those reviews, it might take a more narrative approach, it may be a systematic review, or it may be a more of a meta-analytic review. Okay, and so we see some of those reviews that you can go and read, and so there's been an increase of those, but then that's kind of led to a problem of stakeholders then needing to sort through multitudes of evidence, especially when those reviews might present conflicting evidence. Okay, we go and look at some of the original studies and see that there's support, but then someone does a meta-analysis review of the research and says, well, maybe the strength of evidence isn't so awesome itself. And so essentially, maybe we're to the point where we need to critically appraise the reviews themselves and try to identify different causes of those inconsistencies. So, so an overview or review of reviews where, they're appraising the reviews and sort of documenting the evidence and looking at what's available in there, right? And so there's different, there's one study that one of these reviews that came out in 2024 by Lang Smith and colleagues. I guess I'll refer to that one, right? There's a couple of others that you can look at, but it's an overview, right, of psychological skills training in sport. And one of the major findings of that review was that there's the other reviews that have been done, right? This review of reviews, this overview of other things, is that there was low quality of those other reviews. That was one of the main conclusions, and they use their different tools on how they rated the other reviews, and but there were at least 30 reviews in that study that they included, and 97% of them were rated as critically low quality. And so if you think about this from a scholarly perspective, we don't want to rely on low quality reviews to provide an accurate or comprehensive summary of what it is that we're looking at. We don't want to say, oh, hey, this review showed they came to this conclusion, that psychological skills training works. But really, if you look at it, it was a low quality review in the way that it was conducted. And so that's problematic. We don't want to make a conclusion on something that the strength of evidence actually isn't that strong. And so again, there's some different issues that tie into that. And there's the Lang Smith and colleagues review isn't the only one. There's another review by Slimani and colleagues that came to a similar conclusion, that the quality of evidence in the studies they reviewed, it was low to moderate, different ranges of effect sizes, which is the practical importance, right? Not statistical significance, but it's the practical importance. It's different. And so this is just one perspective of my browsing through the literature and looking at a couple of reviews and how they synthesize the evidence of what's out there to help answer this question. Does it actually work? And really, the strength of evidence isn't great for it right now, okay, from a scholarly perspective. And that doesn't mean that it doesn't work, right? It just means that we need stronger evidence. We need more studies. We need more reviews of higher quality to really make a better determination to truly answer this question. Okay, and within, just to provide a little bit more context on this, when we're looking at some of the studies that have been out there, the types of things that have been reviewed and that have positive reports that they actually work. Some of the interventions, things like imagery, that's been well studied and documented to have evidence for support. Self-talk, absolutely. You work on those things and you have some improvement, and you can get some subjective feedback from athletes, and they'll tell you that improved and it affected their performance. Goal setting is one of the most studied concepts or tools that's out there, and a strong evidence base for that. Okay, but it goes on and on. You talk about relaxation and attentional control or arousal management, things like neurofeedback and biofeedback, where there seems to be growing interest in those because there's more objective measures. If you're looking at someone's heart rate variability in when they do, an imagery session, before and after, it's more objective. It's not them telling you how they feel and whether they feel that it actually worked. You have a metric there. Okay, and then decision making. Okay, so these are just some of the examples of what's included in these reviews, and that's been studied, that again, there is an evidence base to support doing these sorts of things. These are what are involved in those psychological skills training programs. So we can make an assumption that there is some evidence to support these things. It's a matter of a strength of the evidence. And so, like I said, it doesn't mean that we just throw it all out and say that it doesn't work. Absolutely not, because there's evidence that it does, and some of it may be stronger than others. So it's just factoring that in and recognizing the nuance with all of that, and that these things are challenging to measure. It's hard to make those connections between mental skills and the things that they're doing, and then whether that is what actually led to some sort of performance enhancement. And so in closing, just, how do we move forward, right? Because as stakeholders, we kind of have this dilemma where we look and see, well, if we look at the reviews that have been done, they generally report positive effects. So we have that conclusion that there's evidence, but the quality of those reviews is not very good, or it could be strengthened there. And so as practitioners, we have to be cautious when we're making claims about the review level evidence that's out there for these psychological skills training programs and interventions. Okay, so our decision making on what it is that we're going to do if we want to try and replicate a particular program, we have to take in consideration our client preferences, who's in front of us, the context, different resources, not just the scientific evidence. Okay, so that's really important. We don't just want to try and replicate something that's done and say, oh, well, this one, it showed there was positive evidence, because it may not, and most likely it wasn't done in the exact same context that you're working in. So that's very, very important. Our programs have to be tailored to the individual needs and circumstances of who we're working with. And this is something that I've mentioned elsewhere, so I'll just reiterate it, is this is part of the reason why the evidence may not be as strong, is because no programs are the same. It's not truly standardized, so we can't assess it the same way. So you have these varying levels of strength of evidence and support, and it's like, yeah, because every situation's a little bit different. And so we can make that assumption that, yeah, some people have had some positive results here, and so it's likely I can get some positive results, but maybe not using the exact same approach. I have to customize what it is that I'm doing. Okay, and then in terms of the scholarly perspective, different reviews should prioritize, drawing on current and accepted review methodology. You can use systematic reviews or the meta-analyses where appropriate, and then there's different reporting standards, for people that are interested in the scholarly side of those things, that can help improve the evidence base and just have a better understanding, because there is a need for more analyses of what's out there, more reviews to help and define and categorize the psychological skills training interventions that are being done, so we have a common language and we can reduce some of that confusion among stakeholders, right? And then lastly, we just need more primary research, where if we can get randomized controlled trials and where we're investigating different factors like dose response relationships or long-term effects, that's certainly recommended. And those studies are hard to do. They're difficult to do, especially in our world of the social sciences. That can be challenging, but there certainly is a need for that. Okay, so to close things out and bring it all full circle, does mental skills training actually work? That's the broader question, right? We can say yes, but there's caveats, and so how we interpret that matters a lot. And a big reason is because of just the quality of reviews and things that have been done, and the types of studies, a lack of randomized controlled trials, those sorts of things where we have greater strength of evidence. And like I said, there's no standardized approach to this. So maybe we'll never get that strength of evidence that we want, just because we can't truly standardize it, because it needs to be customized. It needs to be tailored to the individuals. And so then this hopefully is encouraging, that we don't say, oh, well, it doesn't really work. It's just we can measure that more on a subjective, boots on the ground level, on how we're determining whether what it is that we're doing is making a difference, right? Because people are dynamic. They're not machines. They're not robots. You can't measure everything and quantify every little thing that it is they're doing. There's some subjectivity. And so how we're interpreting whether things are working, some of that subjectivity is part of it, right? And you want to make it as objective as you can, so you can really kind of augment and triangulate those subjective results. But it's just important to understand all of these things and keep them in mind when we're putting programs together and designing them, and making sure that we have a grounded perspective on this. Okay, and so more could be said on this. I encourage you to go and do more investigating and research and reading on this, and see if you come to similar or different conclusions. That's the beauty of it, is that we can have different perspectives in how we interpret things, and then share that and disseminate that perspective, and hopefully that contributes to us moving forward and having a common understanding as we move forward. So thanks for listening to this presentation. Per usual, I hope you got some things out of it. I appreciate the time and your attentiveness, and hope you have a great rest of your day.
Thank you for listening to this recording in the Sports Psych Lecture Series. I hope you learned something. More importantly, I hope you learned something that you can apply in your life. Feel free to share this presentation with others who might be interested. And if you're interested in more content like this, visit the Fehr Advantage channel on YouTube or find the Fehr Advantage podcast on Spotify or visit my website at fehradvantage.com.